Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome John Erbey. He's a healthcare executive. Today's Kevin MD article is When Normal Creatinine Hides Post-Operative Kidney Injury. John, welcome to the show.
Thank you. Thanks for having me.
All right, so before we talk about your article, just briefly share your story, then we'll jump right into it.
Sounds good. So, not a clinician, an epidemiologist by training, and really, I jumped right into industry and have developed a passion for translating science into business.
Excellent. And why did you decide to write this particular article on Kevin MD?
There seems to be an apparent disconnect, and that's caught my attention over the last couple months. That at a population level, so at the epidemiologic view of it, any decrement in kidney function leads to bad outcomes.
Mm-hmm.
Either increased cost, poor out, events, etc. But at a clinician level, at a patient conversation, that's rarely discussed. And the implications are by the time you catch on to those injuries happening, it's already late in the game, and we needed to have intervened years ago and not today. So that's really, to me, the conversation is why the kidney doesn't get either blamed or implicated in this healthcare crisis that we're in today.
Now, why is that? Why does the kidney sometimes get overlooked?
Well, because it's not the direct cause. I
Yeah.
mean, at the end of the day, the kidney is responsible for maintaining the body's internal environment.
Mm-hmm.
When that doesn't happen, it puts stress on other organs. For example, arrhythmias and the heart, that's an electrolyte issue. Guess what? The kidneys are responsible for maintaining electrolyte levels. Acute heart failure and showing up with congestion and fluid overload. Well, again, the kidney is responsible for keeping the volume in control. And so all of these events happen, and the kidney is silently chipping away at
Mm-hmm.
everything else in the system. So we need to focus there and make sure the kidneys can help do their job and keep the body in check.
Now, in your article, you specifically talk about post-operative kidney injury and why a normal creatinine hides anything to do with the kidney after surgery. So, for those of you who get a chance to read your article, just give us more detail about what it's about.
Well, so basically, what we're talking about is that typical conversation of after surgery, you got a rise in creatinine, but by the time you go to discharge, it's normal. So
Yeah.
you've recovered. That's not really the case. I mean, at the end of the day, most people don't appreciate that the kidney function is dynamic, just like the heart. And just like with resting heart rate variability, you have a renal functional reserve, an ability to compensate for a heavy meal or whatever. And when that function gets chipped away at, you no longer have the capacity to handle that increased load. And so you end up getting into trouble much faster. And it's sort of a slippery slope. And that's really the premise for the article.
Now, you wrote about the JAMA network open study, which kind of challenges those assumptions. Now, for those who aren't familiar with the study, what's that? What are some of the findings from it?
So basically what they found is even when your kidney function returns to normal creatinine, you still have a dramatically elevated risk for morbidity and mortality in the coming years. So that's the that's what I talked about in the beginning about at a population level, the data is very clear. There's a nonlinear relationship between the loss of function and the increase in cost over time. And that's because every time you chip away, every time you move down that spectrum of lost renal function, you accelerate the stress on everything else.
So, in terms of scenarios like readmissions or repeated hospitalizations that get labeled as heart failure or infection, deteriorating kidney function could be the root cause of both of those scenarios, right?
Certainly a contributor. And, at the end of the day, most of these patients have lots of problems. So making sure that you keep the kidney alive, sustain that function for as long as you can will be an important factor in their long-term outcome.
So traditional measures like creatinine and estimated GFR, those are traditional ways that physicians use to measure kidney function. So how can we tell whether the reserve is compromised? What are some other ways that we can assess kidney function?
So there's actually a simple test, and it's a lot like the oral glucose tolerance test that we used to use for diabetes. At the end of the day, if you give a protein challenge to an individual, their GFR should rise,
Hmm.
and that rise is predictable. But when you've had kidney damage and you've lost that function, you no longer see that rise in GFR to help clear the protein load within the body. And it's not necessarily that the kidneys are clearing the protein load, but it changes all of that volume and fluid dynamic. And so that's really what the kidneys are responsible for.
And when should that protein load test be done? What are some of the indications of doing that test?
Well, the test is a research tool at the end of the
Okay.
day.
Okay.
Where we need to think through it clinically is, let's start with the conversation of baseline creatinine is not necessarily the most informative tool. It's funny, like the kidney is an amazing organ. We measure function based on filtration, but that's not what makes the kidney unique. What makes the kidney unique is the ability to reabsorb salt, water, glucose against the forces of diffusion. That's an incredibly energy dependent process. And we never talk about that in the concept of kidney function. Now, the good news is they're correlated. So as you lose filtration, you lose everything else. But it's the concept that, A, it's dynamic, and B, once you've lost that reserve, it's likely not coming back.
Now, before any type of procedure, and I think you wrote an article specifically, cardiac surgery patients are most susceptible. How can we measure the kidney function? What should be done instead if you say creatinine is a relatively crude tool? What else can we do clinically?
Yeah, so we know that patients with renal impairment who undergo these acute stressors, and, so basically any ICU condition, cardiac surgery is the one that's been the best studied,
Hmm.
that and sepsis. So you have this dynamic of, the patient who's at risk, and the time period that they're going to be at most risk. It's, while they're on the pump run and
Yep.
immediately thereafter. And it's making sure that we take care of the kidney as part of that concept so that we don't damage and lose function. Because, to be honest, let's take even a heart attack. Most people don't view that necessarily as a kidney threat,
Yeah.
but ischemia is very profoundly impactful to the kidney because it operates at a level of near hypoxemia to begin with. And so any stressors that challenge the ability to deliver and consume oxygen are very susceptible to the kidney.
So a lot of this is a paradigm shift from managing the complications that can arise from not looking at the kidney or carefully enough to obviously preventing these complications in the first place. Now, if in your ideal scenario, can you give us a case study or example of what exactly would that look like? It could be hypothetical. Just tell us a story about what preventing future kidney issues would look like in the preoperative phase. So, what will be a success story?
So there's two things there. One, by managing, and there are plenty of protocols for this. ERAS is one that I think is the cleanest, where you need to manage the toxins, you need to manage the fluids, you need to manage the exposures so that you decrease the risk of an injury occurring. And to be honest, we're investing in the space because we have an investigational product that we hope will be suitable for this case. But at the end of the day, that trial is still ongoing.
What are some of the approaches that we have to look forward to when it comes to preventing kidney disease? What are some technologies? What are some general approaches that we have to look forward to when it comes to monitoring and preventing kidney disease, especially in the post-operative setting?
So I'm personally excited about how Medicare is taking a more proactive approach to identifying and managing this problem going forward. We've spent a lot of time and energy on the value-based care approach, trying to reduce hospitalizations. That's proving challenging.
Hmm.
And so now they've pivoted and moved towards this teams model of identifying high risk, high acuity episodes and bundling them together so that we can figure out what works and really put the stress on the implementation so that, we'll learn very quickly what works and what doesn't work and can apply that to broader populations.
And specifically with the bundled approach, for those who aren't familiar with Medicare payments, what exactly would that look like specific to kidney injury?
So it's a paradigm shift. Essentially, instead of just using that DRG system where you get paid one check for whatever the admission was, they're now wrapping in a 30-day episode of care.
Hmm.
So longer ICU stays, discharge to skilled nursing, readmissions all get bundled in under that same payment structure. So they're on the hook for doing what they can to improve recovery and get the patients out into the community.
We're talking to John Erbey. He's a healthcare executive. Today's Kevin MD article is When Normal Creatinine Hides Post-Operative Kidney Injury. John, let's end with some of your take-home messages that you want to leave with the Kevin MD audience.
Make sure they leave with the kidney they came in with. And that's not just necessarily getting back to normal at the end. It's making sure that you try to blunt that rise during the times of acute stress.
John, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thanks for having me.